Hi, Sana.
We finally made it.
So, since this is your first time, you want to introduce yourself to everybody?
Sure. Uh, Hi everyone, I'm Dr. Sana Peerbhoy. I'm the founder and the lead dentist at Dental Wellness by Dr. Sana Peerbhoy. And today, today Upasna is getting me to discuss uh, some facts about dentistry. So, I'll tell you the first fact about dentistry, and I know we discussed this yesterday. Dentistry is not magic. That is number one, right? You see a lot of before, afters, a lot of patients have expectations that, it's going to magically change everything. No, dentistry is not going to magically change your life. You have to have some sort of oral healthcare regimen that we can most definitely help you with. The second fact is a lot of people, they kind of bear the pain for a long duration and then they expect that, oh, I'll go to the dentist and everything will be, great. Everything will be sorted. No, we cannot do that for you, right? You have to take care, you have to have regular dental visits. But another fact also is that dentistry is not painful. I think that's something that you and mom have kind of witnessed yesterday. I know she was very apprehensive. Almost 95% of the patients who come to us are very apprehensive. They're not certain as to what they have to expect at the dental clinic, right? A lot of dental clinics right now are absolutely painless. When we do procedures, we do give you a lot of anesthesia. We see to it that you're comfortable. And only once you're comfortable, we go ahead with the said procedure, right? Another fact about dentistry is a lot of, I'll break a myth that is there, right? I'll bust a myth that is there. A lot of people think that, oh, if I'm going to get my teeth cleaned, they'll start moving, right? The dentist will just remove some amount of my tooth material also. No, that does not happen. So a routine dental cleanup, in that what we do is that we remove all the tartar, all the calculus that is there, all the gunk that's there in between your teeth and your gums, and we make it much more healthier. It's only if you maintain that will it remain as it is. Can I do the last one? So the last,
Sure.
yeah. Okay, so the last dental myth or fact is India has a very high population of people who chew tobacco, who smoke cigarettes, or
Right.
who engage in some sort of nicotine activity, right? Be it a vape or be it anything else. So a lot of this younger generation thinks that they cannot have oral cancer, right? So a fact is that oral cancer can occur to anyone. As morbid as it sounds, it's not, cancer is not a disease of the elderly. Cancer can occur to anyone. So I would absolutely tell anyone who's on this live or who's going to watch it later, quit today. It's not that oral cancer cannot occur to me or or to anyone young. Oral cancer can happen to anyone. All you can do at your end is to quit today. And it takes a lot of willpower, I know, but it's for the better.
That's that, that's fantastic that you brought it up. But these were facts about dentistry per se. What makes you, Dr. Sana Peerbhoy, stand out from the rest of the dentists out there today?
Okay, so I'll say a couple of things. Number one is that I have been privileged to have experienced dentistry over the world, right? A lot of dentists right now practicing in India or in Bombay have been limited in terms of their education span. They've gone to university over here, they've gone to dental college over here. I have experienced dental college and dentistry around the world. I've had some experience in America also. So my aim for patients is to bring global standards to a dental clinic in Bombay, right?
Right.
Another thing is that we try and be as inclusive as possible, right? So my dental clinic would never say no to anyone. I understand dentistry. Um, a lot of people feel like it is expensive. We try and accommodate for each and every patient to be treated over here.
And I've
And
seen
besides,
that. You're giving
yeah, and
back.
absolutely, absolutely.
And what about any like third pointer that would make you stand out?
Um, I'd say me myself, yeah. You come, you talk over here, you have a conversation. And there's much more. So I've seen what happens is most of the patients go to their dentist, right? They get the problem solved or they get the problem fixed, and that's it. They go back to their routine habits, right? I try my best to encourage all my patients to, improve their oral health care regimen, right? Like include a different technique of brushing. If there's something that you've been doing in the past, I'm not denying that you're not doing it, but possibly that you're not doing it to the optimal requirement, right? So we give a lot of importance to at home practice that you have to do.
Okay, that's great. And you want to remind all the people who joined of the offer that you were giving for the members?
Can I be honest? I've forgotten what the offer was.
I think something about a free checkup or something.
Oh yeah, we're doing a smile.
Right.
That okay. So we're doing a smile consultation. It's basically for any and everyone. Um, if there's something about your smile that you don't like, if you feel like your teeth are crooked, or if you feel like your teeth are slightly malaligned, one is slightly in the front, or maybe there's a tooth that is slightly darker than all the other teeth and that has been bothering you for your entire life, just go ahead and shoot us a message and we'll do a very quick virtual consult, and then we can have you in the clinic also and give you all the possible treatment options that are available.
Yes. And I have personally been to her clinic. It is not foreboding. You will feel very welcome and you will want to go back hopefully for your checkups. So please go ahead, drop into Dr. Sana Peerbhoy's clinic or drop her a message, take a appointment soon. And thank you, Sana, for joining today.
A lot of people on this live have already come to the clinic, right? I'm trying to see everyone on here, and most of them have already come to the clinic, so I'm already great. But yeah, so I think one thing that you would observe when you come to the clinic is that you'll understand that dentistry is more than just a filling or a tooth that is troubling you, right? You can incorporate a lot of stuff on your own, and you can maintain. So something that I've noticed that's not in India, we don't go towards preventive care, right? We always look at, okay, now there's a problem, how do we fix it? But we never foresee that, okay, how do I prevent this problem from occurring in the future? Right? So that is something that I most definitely have a conversation with all my patients that, hey, this is what has happened, but we can most definitely fix it right now. And trust me, there are fixes for every possible problem that you have, right? So we'll most definitely fix it. And here's what you can do, here's what you can incorporate in your regular oral care that it will not occur in the future.
Fantastic.
So
Fantastic.
now that I remember is why should people come to my clinic? There's been a lot of effort, there's been a lot of time, and my interior designer will tell you this. I have sat for hours with him and seen to that I do not miss out on very minute details. So I had an auntie who was 85 years old yesterday, and she called in and she's like, I can only come in on my wheelchair. And I'm like, don't worry, auntie. I have foreseen that a lot of geriatric patients or a lot of our senior patients, they are maintaining their teeth, right? So as long as you maintain, you definitely need to go to the dentist routinely. So I'm like, don't worry, my entire clinic is wheelchair accessible. Right from, we've also seen to that it's on the ground floor itself, so that there's no staircase, no lift involved. Right from when you enter the building, it's a gated community. You enter the building, we have a ramp for the wheelchair. The entire clinic was, planned in such a way that every corner is accessible for patients who are wheelchair bound.
And it's brilliant. It's beautifully made and it's fantastically spacious. I love the amount of space that you've kept for your where you do all the checkups and everything. It's
So that's
fantastic.
where I'm sitting. Let's see if I can pan around the area really quick. So this is the operatory space. I kind of prefer to not keep any instruments outside because I know that is at times a little daunting for a lot of patients. We have an in-chair or we have an in-ceiling television that is there for a lot of patients who want to come do a quick whitening, So at times, whitening or bleaching takes about 30 minutes per cycle. And all we do is that we just turn on the television, they're watching Friends or they're Netflixing, they're doing whatever they want, and they're absolutely comfortable. It also works for kids, right? The minute they come, I ask them what their favorite cartoon is. I think right now what's trending is Peppa Pig. All of them will have me switch on some version of Peppa Pig, and I'm like, okay, as long as you're engrossed with that, we can continue with dentistry. Another thing is that the clinic is a family dental care center, right? So we take care of each and every person of your family, be it the smallest kid that's there, we have a periodontist on our panel, be it a child who needs some braces, we have that. If you have a tooth that requires root canal, we have a root canal specialist. I myself look into crowns, bridges, veneers, smile designing. And we also have a periodontist who takes care of our implants.
That's fantastic. And hopefully, Sana, thank you so much for joining us. And hopefully, you'll be able to do this the next week also.
Absolutely.
With
Trust me, I had blocked the time for Upasana. I'm like, this is Upasana's time.
thank you. Thank you so much for joining us. And thank you, everybody else, also for joining us today. All the people who've come to support Doctor.
Absolutely. I'm telling you, I was spamming everyone. So I'm going to check attendances on this.
Oh my God. Best of luck with that. Thank you. Bye.